Prevention is not always possible. I'm going to say that, which is difficult. But there are things that we can put in place. I've mentioned a few of them. Again, I'll focus on the training and practice and preparation, partnering with safety and security, and really assessing the physical environment as well as all aspects of the environment. So doing a very or enabling others to do a very comprehensive risk assessment. A simple example might be a triage room, for example, in an ED where the nurse is facing the door and has no way to exit, for example. Those kind of things we can address. I've heard of one of the hospitals across the country. I heard of an incident where a patient smashed a painting and used that glass as a threat. So, look at your environment and just look to see what can be prevented. Um, Working with the community is another piece that I think is very important. Partnering with our law enforcement folks and other agencies in the community, because this is really a reflection of society and the increasing violence in society. And then there are a number of technical things that can be helpful. If you can't always prevent, you can certainly work to um, mitigate the impact of violence. So, for example, you may not be able to prevent someone from getting agitated, raising their voice, but you might be able to intervene so that it doesn't proceed to injury. With some of the technology that's out there now, with where you can have a button or some type of alert on your badge or on some other type of device, and you can alert folks when you need help. That can prevent an incident from going to injury. Behavioral health response teams, where you have individuals at your sites, in any care site, that have some additional training, that when you feel as though a situation is beginning to escalate, you can call for support and have that show of support, as opposed to a show of strength, a show of support for both the patient and for the nurse at the bedside. And there's many other things, but I think there's some of the foundational things. Have a excellent reporting system, so that you know exactly where things are happening, and you can say, here's an area where we have a real problem. What's different about that, and what can we do? So a range of things that can be done. But I think the most important, if I go back, is to say the nurse leaders and chief nursing officers advocating, understanding some of the evidence that's out there, what works best, and advocating in their organizations to implement those, not just technological things, but the processes. And then lastly, supporting those who are victims of workplace violence, and not just the individual who's involved in it, but it impacts everyone that's present.